Hello everyone. So last class we discussed about the individual manual muscle testing for coracobrachialis, deltoid medial fiber, anterior fiber and posterior fiber. So today we'll discuss for rhomboids, trapezius, latissimus dorsi and some of the other muscles of glenohumeral joint. So first muscle we are going to discuss is rhomboids. So as we know, the rhomboids is placed between the spine and the scapula. So we have rhomboids major and rhomboids minor, and its function is adduction of the scapula. So it is not adduction of the glenohumeral joint, it is adduction of the scapula, which means scapula moves towards the spine, that is vertebra. So its attachment that we should be knowing from anatomy, that is from the spine of the vertebra from C7, T1, T2, T3, T4 and T5 for rhomboids minor and major, and it's attached to the medial border of the scapula. So when it contracts, it creates elevation of the scapula as well as the adduction of the scapula. So adduction is the primary function of the rhomboids. So how should we position the patient to examine the manual muscle testing? So patient should be in prone lying, and the shoulder should be abducted. As you can see in the picture, shoulder is abducted to 90 degrees so that the rhomboids is exposed to the gravity. And one more thing we have to remember is the shoulder should be internally rotated with thumbs down position. So the thumbs down indicates that the shoulder is internally rotated. So in this position, we'll ask the patient to go for adduction of the scapula. So again, we have to instruct to the patient concentrate on rhomboids contraction rather than deltoid contraction. So in this position, if we ask the patient to go for adduction of the scapula, patient also has to perform horizontal abduction, or also you can call it as horizontal extension, activating the posterior fibers of the deltoid. So the concentration should be more on the rhomboids contraction. So patient is asked to perform adduction of the scapula and elevation of the scapula, and then if patient is able to perform that, we'll grade it as grade 3 against the gravity in prone lying position. If patient is able to perform against resistance, we can grade it as grade 4 or 5. Now some patient cannot perform against resistance throughout the range of motion. Like for example, if we apply resistance from the start position, then patient may not be able to perform adduction of the scapula. So we can, in that case, we can perform break test. So break test means the patient is allowed to perform the movement against gravity, and at the end range we will apply the resistance, so against the movement, and we'll see if the patient is able to maintain that position for a few seconds. So if patient is able to perform break test, that is maintain the position against resistance at the end range, then we can grade it as grade 4 or grade 5 depending upon the amount of resistance applied. Now let's see the video demonstration for rhomboids. So patient is in prone lying position where patient performs adduction of the scapula. Again, we have to keep in mind that adduction of the scapula should be the primary focus rather than the extension of the glenohumeral joint in abducted position of the shoulder. So here patient is performing more of extension of the shoulder. Here you can see. So while performing extensions, he also is performing the adduction of the scapula. Now if patient is able to perform this movement, then we'll apply resistance against the movement. So the resistance applied throughout the range of motion, and patient is able to perform adduction of the scapula against resistance in thumbs down position, that is in internally rotated position of the glenohumeral joint. If patient is not able to take resistance against throughout the range, then we can perform break test. So again I repeat, break test means applying resistance at the end range of the motion, that is patient first performs the adduction of scapula by raising her arm against the gravity, and at the end range the resistance is applied, and we'll see if patient can hold the position. Now next we'll see for trapezius middle fiber. So this trapezius middle fiber is the position, starting position is similar to rhomboids, but only one difference here is the shoulder is externally rotated. So the position is same as rhomboids, where prone lying position with abducted shoulder to 90 degree, abducted glenohumeral joint to 90 degree, and the glenohumeral joint is externally rotated here with thumbs up position. So in this position, we'll ask the patient to again perform the adduction of the scapula, where the function of middle fiber is again adduction of the scapula. Just the attachment is changed. Instead of middle border of the scapula, the trapezius is attached to the spine of the scapula. We'll ask the patient to perform adduction of the scapula with laterally rotated glenohumeral joint. If patient is able to perform against resistance, it is graded as grade 3. If patient is perform against resistance, it is grade 4 or 5. So again, we can apply brake test if patient is not able to take the resistance throughout the range of motion. So you can see here thumbs up position means externally rotated glenohumeral joint, and patient performs adduction of the scapula. That means scapula moves towards the vertebral spine. That is medial shift of the scapula. Then we can apply resistance to see if grade 4 or 5 can be achieved. So this was for rhomboids and trapezius, which is similar. Just the change in starting position is for rhomboids is medially rotated glenohumeral joint, and for trapezius it is externally rotated glenohumeral joint. So moving on to next muscle, that is trapezius lower fiber. Now to expose the trapezius lower fiber to gravity, the position is same, the prone lying, but the position of the abduction changes here. The shoulder is abducted more than 90 degree, approximately 130 degree glenohumeral joint abduction. In this position, the lower fiber of the trapezius is exposed to gravity, and the function of lower fiber is more of depression and adduction. So it depresses the shoulder downwards and also adducts towards the spine or adducts towards the vertebral column. So in this position, starting position, we'll ask the patient to perform adduction and depression of the scapula. Again, we have to keep instructing the patient rather than concentrating the muscles of deltoid or upper trapezius, any other muscle. We have to ask the patient to concentrate on the contraction of the trapezius or the muscles around the scapula in this position. If patient is able to perform against gravity, then we can apply resistance, which could be brake test if patient is not able to take the resistance throughout the range of motion. So here you can see the position of the glenohumeral joint which is abducted more than 90 degree, and we ask the patient to depress the scapula and adduct the scapula. Depress and adduct the scapula. While you raise the arm, it depresses the scapula and adducts the scapula. Now next is with resistance, patient performs depression and adduction of the scapula. So this was for trapezius lower fibers. So all positions were on prone lying position. Now next, moving on to upper fiber trapezius, the starting position is sitting position. So patient is in sitting position, and we'll ask the patient to perform function of the upper trapezius. So what is the function of upper trapezius? Its function is side flexion to same side, rotation to opposite side, cervical side flexion to same side, cervical rotation to opposite side, elevation of the scapula, and extension of the cervical. So these are the functions of upper trapezius. So we'll ask the patient to perform this function, that is the taste movement function of upper trapezius: elevation of scapula, extension of the cervical, side flexion of the cervical to same side, and rotation of cervical to opposite side. So if patient is able to perform elevation in this position, elevation of the scapula in this position, that is rotation to opposite side, side flex to same side, etc., then we can grade it as grade 3. And if patient is able to perform against resistance, it will be grade 4 or 5. So we can apply break test if patient cannot perform throughout the range of motion. So first demonstration is for grade 3, where patient goes for extension, rotation to opposite side. We are testing the left side trapezius, upper trapezius, side flexion to same side, and elevation. So patient's upper trapezius is strong enough for grade 3. Then we'll apply the resistance. In this position, extension, rotation to opposite side flexion to same side, and elevate against the resistance. So that can be graded 4 or 5. So this was for upper trapezius. Now let's move on to next muscle, that is supraspinatus. Now for upper trapezius and supraspinatus, it is similar starting position, where the starting position for upper trapezius was sitting position. So similarly for supraspinatus, it is sitting position. But here we have to relax the upper trapezius. So how we can relax the upper trapezius? We can ask the patient to go for rotation to opposite side flexion to same side, and extension. And if required, we can elevate the scapula to relax the upper trapezius. But elevation of scapula may not relax, so therefore we can consider that. But rotation to opposite side and side flexion to same side will relax the upper trapezius, and then we can easily palpate the supraspinatus. So in this position, we'll ask the patient to do abduction. So the function of the supraspinatus is abduction of glenohumeral joint. And we can apply pressure for grade 4 or 5. So let's move on to the video demonstration. So first patient performs the grade 3, that is, first we have to relax the upper trapezius. So patient performed side flexion to same side, rotation to opposite side, and extension to relax the upper trapezius. And then we abduct the patient abducts the glenohumeral joint to test if the muscle is grade 3 against the gravity, supraspinatus muscle. Now we can apply the resistance in this position, and then check if patient can perform against the resistance. So we can fix the scapula here if you want to fix the proximal part of the joint, that is scapula. So this was for supraspinatus. Next muscle is latissimus dorsi. So to perform MMT for latissimus dorsi, which is a big muscle situated in the posterior part of the trunk, that is thoracic and lumbar area. So it has function at the glenohumeral joint as its attachment or the insertion at the floor of the bicipital group. So it functions as rotation, that is internal rotation of glenohumeral joint, adduction and extension of the glenohumeral joint. So we'll ask the patient to perform the same movement to test if the muscle is functioning. So the position is prone lying. We'll ask the patient to perform the function of latissimus dorsi, that is adduction of the arm with extension of the glenohumeral joint in medially rotated position, or we can ask the patient to perform medial rotation along with extension and adduction of glenohumeral joint. Now pressure or the resistance is applied against the forearm, you can see in the picture. So it is applied against the movement, that is against the adduction and against the extension. So first video demonstration is for grade 3, where patient performs adduction, extension and medial rotation. You can see again medial rotation, extension and adduction. And second one is where resistance is applied at the forearm against medial rotation, adduction and extension. So we should try to reduce the co-contraction of the muscles as much as we can. It should be more smooth. Now let's move on to next muscle, which is teres major. The function of this muscle is internal rotation and extension. Similar to latissimus dorsi, but this is a small muscle. Here the position should be prone lying with medially rotated glenohumeral joint and hand resting on the posterior iliac crest. And the test position is extension and adduction of the humerus in medially rotated position with the hand resting on the posterior iliac crest. The pressure is applied, you can see, at the level of elbow, distal part of the humerus.